I think the highest calling of our healthcare work is in the support that we give health institutions, helping them serve the communities that they serve and that many of us live and work in. And we're just one part of that through planning and design.
Atrium is a large enterprise that has grown through several mergers and acquisitions. One of the many reasons that the organization chose to pursue prefabrication and standardization was that we just had multiple large capital projects happening at once. Really choosing to do that gave us greater speed to market. It's a heavy lift at the beginning to really create that alignment and get those early decisions, but you really start to quickly gain momentum and speed, and it really helps you later in the process where things happen very quickly and there are less changes.
The CMC New Bed Tower, other projects in the strategic capital plan that Atrium has undertaken with this, all have a goal of significant percentages of the construction being driven by prefabrication or made up of prefabricated elements. In fact, the New Bed Tower at Carolinas Medical Center has a goal of 60% of its elements prefabricated and assembled on site, and we are on track to meet that goal. I think it's important to draw a distinction today around this notion of cost between driving cost certainty and cost saving. Cost saving is reactive. Cost saving is done when risks haven't been properly managed. Cost certainty is proactive. Cost certainty is about identifying potential risk that may or may not happen and managing to that potential. And that's where standardization, prefabrication, componentized construction, that's the real contributor to driving cost certainty. So it's really important for us to be thinking about strategies and approaches from design and construction that allow that potential risk to be minimized as much as possible.
This is about controlling our destiny. It's controlling outcomes for clients. Prefabrication matters because of the shifting landscape of construction, availability of manpower, of a need to provide speed to market for clients. There's a lot of interface as you bring a building together, and the more we can define those tie-in points, the more we can develop a strong plan because we've got certainty in what's going to be there. It gives us better ability to communicate and execute at a high level.
Prefab for our patients, in terms of the care that they're being provided, I think it's just creating that consistency for the family and the patients to know where things are and what to expect. But it's also a level of quality, I think, that we're able to provide in our prefabricated bathroom pods, on our head walls, being able to make that care environment flexible and adaptable to meet the patient acuity needs as they might change across their journey.
Minimizing variation in the delivery of care is a key focus area as we think about population health and health equity and how to provide equal access for all. And that's really one of the cornerstones of standardization and prefabrication and why it's important to what we do in design and construction.